Welcome to Portable Mindful Strategies for Self-Care, the Mantram Repetition Series. And this is the final session, 4 out of 4, and we're going to put it all together. And I'll be your narrator, Dr. Jill Borman. And in the prior 3 sessions, hopefully you've learned what is a mantram and how to choose and use one. You've learned about the importance of slowing down and practicing one-pointed attention. And today we're going to put it all together. So this will be the final session. Again, I can't stress it enough to practice and practice. The objectives for this last session are the following. We're going to demonstrate how slowing down and one-pointed attention complement each other for making healthy choices. And we'll discuss applications of this Mantram program for health and well-being. We'll describe ways to keep practicing the Mantram program tools for the rest of your life and ways to use the Mantram program to improve your self-care and caregiving. So before going any further, one of the things that's often done in a Mantram class is to share Mantram stories, to give examples and observations or successes, as well as talk about any obstacles or setbacks that people may have in doing this program. And in telling Mantram stories, we have numerous examples and ways that people have used the Mantram. And here's a quote from a veteran with post-traumatic stress disorder, or PTSD.
If I find myself getting into a bad mood or depressed, how can I say it? When I have no patience with myself, and I find myself going back and beating myself up over issues or whatever, I do my Mantram at that point of time, and I get more relaxed, where I can start thinking other thoughts.
And here's another example. This was a quote taken from the spouse who was the caregiver of a veteran with dementia. I use Mantram repetition during impatient incidences when my husband needs my attention. So, for example, when you have a patient who keeps asking you the same question over and over again, a person who has dementia and they can't remember what you've told them, that's a good time to use the Mantram to remain patient and calm in trying to answer their questions. So the Mantram repetition practice can be used in a variety of situations to manage a variety of feelings, including grief and loss, frustration, anger. And by repeating the Mantram, doesn't necessarily mean the feelings go away, but the Mantram is like a staff. It's like something to hang on to. It's a stabilizer so that you can better manage those feelings. You'll still feel them, but you may not be swept away by them. And as discussed in the prior sessions, slowing down. Have you had any observations about how speeded up you are? Have you found new ways to maintain slowing down? And how's your one-pointedness? Are you aware of becoming one-pointed when talking to others? Are you doing less multitasking and more monotasking? And this might also be a good time to recognize the different phases of Mantram practice. The mechanical phase, which is the mind-body conditioning, is usually felt in the beginning, and after having an experience of noticing how the Mantram has helped you in some way, by being less reactive, by using as a pause button, we have an experiential awareness of the program. And we can go back and forth between mechanical, experiential, and that can happen for a long time. Our goal, however, is to get to habitual, the point at which your Mantram is there for you all the time. And that's where you want to work towards, and that's what we hope to gain. So to help you review various times and places that you can be repeating your Mantram, here's a list of questions. Are you using it every night before falling asleep? Are you using it while walking? Are you using your Mantram when you put on your seatbelt? Or to deal with traffic or road rage? These are all really great ways to use Mantram repetition. So if you've been practicing these tools and strategies, how do you best evaluate the outcomes? The best way is to ask yourself, are you more calm and patient? The best way to evaluate the program is not necessarily by how frequently you practice repeating your Mantram, but by observing your own behavior and your own emotions. And another benefit of the program is that how you respond in your own life, whatever your behavior is, can also influence the behavior of others. So as we practice these tools, we can actually influence those around us. What's the number one barrier for you in keeping up with a behavior change? Here are several common barriers. First of all, I simply forget. That's probably the number one barrier or problem that people have after learning Mantram repetition, slowing down, and one-pointed attention. Another barrier is not having the support from others to continue. It's great if you know someone who also practices Mantram and you can talk to them about it. You can tell Mantram stories. But for most of us, if it's out of sight, it's out of mind. There may be other barriers that you can identify of ways that keep you from practicing so that you can then overcome them. And so finally, the take-home message is that we can't always change the things around us, but we can learn to change our reactions to them. And what Mantram repetition and slowing down and one-pointed attention together can help us do is to pause for a moment and evaluate where we are in the situation. And although we maybe can't change it, we can calm ourselves down, we can react with intentionality, we can make wiser choices. And there's a 5-minute video that you can find on YouTube, and it talks about how veterans are using the Mantram for post-traumatic stress. This was an interview done by KPBS local radio, and it talks about how veterans are using the Mantram to help them manage symptoms of post-traumatic stress. So some final tips to remember is to keep using the Mantram as much as possible. Keep slowing down. Notice when you're speeded up, and keep practicing one-pointed attention. For other materials or more information, you can check out the Blue Mountain Center of Meditation located at www.eshwarren.org and also www.jillborman.com. Thank you for participating in this version of Mantram repetition for Psych Armor. I hope you find it's been helpful.
If you are a caregiver of a veteran and would like assistance or have any questions, go to the Psych Armor website or contact the Psych Armor support line at 844-779-2427. Your feedback is important to us. Please click the link at the top of the screen to go to our survey. Thank you for completing this course and taking that one step further in learning about our American veterans. If you have any questions or need assistance, go to the Psych Armor website or call the Psych Armor support line at 844-779-2427. Thank you for completing this course and taking that one step further in learning about our American veterans.